Craig on St. Patrick's Day, and I said, does your family have any traditions for this day? He said, no, not really. My name is really Craig Cushingham, and you can see it on the bottom of the piece of paper that he passed out for you. He said Cushingham was pretty much made up. A lot of story behind it. Make sure you have coffee with Craig. But when you are with him, know that you are with a descendant of Hawaiian royalty. There is a king in his past. Now, Craig and Carmita are now empty nesters, but come September, they will welcome a first grandchild, a grandson, to carry on this family made-up name. Craig stays current, we know that, with all of the changes in healthcare on a daily basis, but every fall he expands that knowledge with 6 to 8 weeks of continuous education. Please give your full attention to the ever-improving head of the growing Royal Cushingham family, Mr. Craig.
Thanks, Gloria. Yeah, my father was born in Honolulu. His father was born in Honolulu. And the generation before that was an Irish engineer that was brought to Hawaii to build a sugar mill and married a Hawaiian princess. So I have yes, that's what every Irish person would love to do. Is move to Hawaii and marry a Hawaiian princess. So when they came over from the Irish potato famine in the 1840s with this name, they said, how do you pronounce that? And they said, well, in New York City, we pronounce it Cushingham. So if you ever meet a Cushingham, they are a direct relative of mine. There's only about 20 of us in the country. When I was over in England 20 years ago, I made a call to one guy in Scotland, and I said, hi, I'm Craig Cushingham. I see that you are a Cushingham. He goes, I am the last. The last in UK. So, interesting. But what I want you to do is pick up one of these referral triggers. Referral records. Now, when you give me a referral for somebody who is over 65, you must check, we'll call you. If they are under 65, you can check, expecting your call, or we'll call you. The government says that I cannot call first time for someone that's over 65. But everybody else in the country, I can call and I will. No problem with that. And there are 10,000 people a day turning 65. And those people all need to talk about Medicare insurance. Well, I handle that. But today, we're going to talk about life events that may qualify you for a special enrollment period for the under 65 market, and that is Affordable Care Act. Some people call it Obamacare. In order to have major medical health insurance, open enrollment ended February 15th. So you have to have a government-approved reason, and the first one is losing other health insurance. Examples, if they're on COBRA, if they just gotten fired from a job, if they just leave a job and they want to open up their own little small business, they want to work for themselves, or they happen to be turning 26, which means that they must come off their parents' policy and get their own policy. That's a great person for me to talk to so that I can walk them through the steps on how to, because they only have 30 or 60 days to make that transition, depending on what the reason is. And another one is permanently moving outside of your plan's coverage area, which for us would be moving into a different state. But it also could be moving into a different county that isn't offering that health insurance. So if they get the letter going, you're no longer covered, have them call me or give me their number and I will call them. If they're getting married, if they're having a baby, if they're adopting a child, if they're getting U.S. citizenship, if they are getting out of jail. Not my primary client, but I can help them. And That last at the bottom, it says for people already enrolled in the marketplace. They already have coverage now. They're getting a federal subsidy, but they're having a change in income. At that point, they can then call me and choose a new plan, either more expensive or less expensive, because when they change their income, the beginning of the next month, their federal subsidy is going to either rise or lower. And if it lowers, they may need a cheaper policy in order to keep food on the family table. So these are the reasons that people can talk to me now. Otherwise, they have to wait until November 1st to start on a January 1 policy. But let me mention one other thing. If they don't have one of these reasons and they have no health insurance, I'd rather have them have something rather than nothing. And the something they can have is short-term medical. Will it qualify to keep them away from paying the penalty? No. The penalty for 2015 is $395 an adult, or 2% of your adjusted gross income. So if they make $100,000, they're going to pay $2,000 in a tax penalty. That's what the Supreme Court said. But what the government says is it's a shared responsibility payment. So if you know somebody that doesn't want to pay the shared responsibility payment, but they did pay for it in 2014, they have another reason between now and April 30th. If they paid a penalty for 2014 and they don't have anything right now, I can sign them up for a regular plan. They just have to call me before April 30th. So none of us want to pay that penalty, but you want to have the health insurance before you head to the hospital, because if you're in the hospital, you're not going to be able to get it, or at least you're not going to be able to get it till the first of next month, and quite frankly, that's too late. So I'm looking for people that don't have it, are wondering how much it's going to cost, but one of the big reasons is they want to talk to me is because they have to find out if their doctor is going to be listed. This book is from 2002. This book is from 2008. They don't make them anymore. So they have to call me, and I then can find which programs have their doctors on it, because that's the big secret that nobody knows. They know what the price is, but then they go to their doctor and they find out after the fact, too late, that their doctor doesn't take it. Well, I make sure that their doctor takes it before they sign on the dotted line. And that's what I can offer your clients. Their prescriptions are covered, their doctors and hospitals are in, and then I look at the cheapest of the companies that are left. I'm Craig Cushingham. I handle health insurance.